Well, hello everyone, and welcome to another COVID-19 community update here for the City of Brandon. And just for context, we are recording this on Monday, August 24th. So today, as usual, you have myself and Mr. Brian Kays, our emergency manager. And today, we have a special guest, Dr. Amy Frakota, who is Prairie Mountain Health's Medical Officer of Health, and we're going to hear from her in just a few minutes. As you know, there's been lots going on in Prairie Mountain Health as a region and in Brandon specifically as well. Lots of new information we're going to get into, and we're most pleased to have Dr. Frakota here to help unpack some of this information and give us a lot more of the guidelines that have rolled out for our region. So without further ado, I'm going to call on Dr. Amy Frakota.
Thank you, Mayor Crest. I'll just ensure that we're recording this remotely, so I wanted to ensure that things were accurate and in place here at this point. Thank you very much, Mayor Crest, for the opportunity to share again today at this local broadcasting. I wanted to share first where we're at with cases in Prairie Mountain. And since July 1st, we've had 320 total cases in Prairie Mountain Health Region. Currently, we have 196 active cases. As many heard over the past weekend, August 22nd and August 23rd, there were a number of cases reported to Prairie Mountain. The data was corrected today for what cases were incorporated on what days or inputted on what days. And as of Saturday, we had 66 cases for Prairie Mountain, and Sunday had 14 cases. Connected still with the business in Brandon, in total we have had 52 total cases there, and 34 of those cases are active. As you know, starting today, Prairie Mountain Health will be elevated to the restricted level or orange category according to the pandemic response system. And I'll talk a little bit more about that shortly, but first I wanted to talk still about some of the cases and why the decision was made to increase the restrictions in Prairie Mountain to the orange level. So this decision was made, and it was driven by a number of factors, and primarily it was driven by multiple clusters that we're having in Prairie Mountain and some level of community transmission. The majority of cases are still connected to known clusters or to known cases, but we have noted multiple clusters that are not connected and that have been occurring. As well, we've had a trend, as I've mentioned, towards more community transmission. The province has been noting at this point a community transmission rate of 19 to 20%. We have not been providing specific community transmission rates by localities, by health region at this point, as we're waiting to ensure to validate that data. And for the clusters and cases that we have in Prairie Mountain, there were acquisition events and exposure events, so where they may have acquired COVID or had different exposures to COVID that occurred throughout the region. And this therefore led for the need to have the alert or the orange restricted level throughout our entire region. We do know that there were many exposures at various gatherings, public gatherings, family gatherings, places that people had got together, gatherings at a beach, and so forth. And we really feel more that this was that people had somehow lost touch with the fundamentals. I mean, it's easy to understand. It's been beautiful, a beautiful number of weeks in Manitoba. We've been out enjoying the summer weather. And unfortunately, amidst that, people had forgot or lost touch, as we said, with some of these fundamentals, and that has led to increased transmission of COVID in our region. We know that the virus does spread from prolonged close contact with one another, and that is what the epidemiology or data is showing us, and is showing that that has occurred within gatherings of people together, public gatherings. We do not have implications for businesses. We have not noted transmission through restaurants or through other business sectors, and that's why the approach that we have at this time has been just targeted to primarily public gatherings. Other indicators that help lead to the decision to where we're at, we're looking at the test positivity rate, the increase, as we said, of cases, the increase in clusters, and again, the increase in numbers of concerning exposures that we've seen with these types of gatherings that people have unfortunately not been adhering to the public health recommendations at these gatherings. Again, back to some of the other data in Prairie Mountain, as mentioned about the data for the business that has been noted to have cases within it. We do want to again state that there has not been any evidence of inter-facility transmission there. The business has done an excellent job. They have protocols in place that are going above and beyond what normally we would be doing in public health. They have numerous barriers, monitoring, cohorting of groups, and protective personal equipment. As well, we have regular meetings that are occurring with the Canadian Food Inspection Agency, Manitoba Agriculture, Workplace Safety and Health, Resource Development, and the employee there themselves. And all of that, we do not have indication or reason there's no reason that we believe that there's any level of inter-facility transmission at that site. As noted on the weekend, there was a significant surge of cases in Prairie Mountain, and these were linked to intentional testing that was related to known clusters in communal living communities in Prairie Mountain. There's been substantial testing on and off of various communities and mobile testing, and from that is where we did receive many of the results related to COVID. We do want to point out that while that number is high, it is also a very good thing. It means that we are being proactive and we can self-isolate cases and prevent further spread. And we do appreciate that the communities have had this testing going on. We want to acknowledge that the communities involved are cooperating and want to help get their communities and region healthy. And very much that we do appreciate that. As well, our public health capacity is continuing to be able to support the cases that are occurring. Although it has been stretched with the number of cases that we have been seeing, public health has still continued to meet the targets that we have in our province, which is reaching the cases within 24 hours. And we are reaching 95% of the cases within 24 hours in Prairie Mountain Health Region. Now I'd like to talk about the restricted level orange that has been implemented on our health region. Again, this has been led by the data of what we've been seeing, and this is primarily linked to those with gatherings of people together, and that is why the approach has targeted specifically on that. As of today, public health Prairie Mountain Health Region has been elevated to the restricted level orange. What this will mean is that as of today, masks will be mandatory in all public indoor places and at all indoor and outdoor public gatherings. Public gatherings will also be restricted to 10 people, both indoors and outdoors. In addition, we will continue to monitor the situation in our region, and if we do see other factors that we feel we need to put further additional restrictions on, we will implement those if those are necessary. In regards to the public gatherings, both the indoor and outdoor gatherings, as I've stated, are limited to 10 people. This includes gatherings that are weddings, funerals, banquets, receptions, and professional sporting activities. More than 10 members of the public may attend a business or a facility that is allowed to open under these orders if public distancing measures are in place to allow people to maintain a distance of at least 2 meters. For additional details specific to the order, you can look at the Manitoba website, and there will be the details, further details outlining specific indoor public places and outdoor public places. The operator of an indoor public place must ensure that every person who is not wearing a mask while in the indoor public place is given a reminder to do so as soon as possible following entry. As well, masks are not required if people are seated at least 2 meters from others, or if there is a non-permeable physical barrier, such as a plexiglass barrier. However, people do need to wear a mask at all times while moving to or from their seated position within the indoor public place. In addition, employees, contractors, or operators of an indoor public place do not need to wear a mask while they are in an area where members of the public do not normally have access, or if they are again behind a non-permeable physical barrier, which would include a plexiglass barrier. There are some scenarios where people can temporarily remove their mask while in an indoor public place, and these scenarios are if someone was to receive a service that requires the removal of the mask, if they are actively engaged in an athletic or fitness activity, including water-based activities, or act as a lifeguard, if they are consuming food or drink, if they are dealing with an emergency or medical purpose, and if they need to establish their identity. People who do not have to wear masks include a child who is under 5 years of age, or a person with a medical condition that is unrelated to COVID-19, including breathing or cognitive difficulties or a disability, which prevents them from safely wearing a mask. And lastly, another person who would not have to wear a mask would include a person who is unable to put on or remove a mask without the assistance of another person. There's a lot of information there, and I know that it has been stated already, some of the similar information by Dr. Brent Roussin today at his media briefing, and I wanted to share that further with yourselves at this point also. In regards to how long we anticipate these restrictions to be in place, we know that we'll have to have them for a minimum of 1 incubation period. What does an incubation refer to? An incubation period, that is a time frame that we look at as 14 days. So we anticipate likely this would at least be 2 incubation periods, because we will not have a sense of what is happening with the trend if we are seeing a downward trend because of what we've been working hard as citizens here to put in these restricted measures. So we likely anticipate that this will be at least 2 incubation periods. And when do we expect to see changes related to ourselves in Prairie Mountain following these restrictions? It may take up to 10 to 14 days to see those changes. Again, the time frame that we anticipate within that first incubation period. Regarding enforcement, yes, enforcement is an option related to those not following the current recommendations. But we always want to start with education and support. That has been our areas of most success, to have the citizens following with the public health recommendations. But if that does not allow cooperation with these, then we do need to look at enforcement. And this is an option, and we will consider enforcing these orders, and those could be in the area of ticketing or other manners. In regards to questions around school, because many people have had concerns related to school and how these current public health restrictions in Prairie Mountain may affect the schools, there has been a lot of work going with the Ministry of Education and the Department of Health over the last number of weeks. As well, since the public health restrictions in Prairie Mountain have been discussed and been implemented, there's been further work through these 2 departments. There has been consideration for if other alternate methods or protocols may need to be in place in our health region. And this upcoming Thursday, both myself and Dr. Mark Cassavant from the Brandon School Division will be presenting along with the team here on the local broadcast with Brandon, and we'll be sharing further around the schools. At this time, we do not anticipate that we will have further school closures. We are anticipating opening the schools as has been thus far mentioned by the school divisions in our areas. I'd like to again talk about the fundamentals as to what I had shared last time, and I do appreciate everyone and all that you've been doing in regards to following these fundamentals. And we do want to encourage to continue to follow these, because we know that they've helped in the past, and perhaps in Prairie Mountain we have lost some focus on these. So we want to encourage again everyone to follow these, and in addition now to be wearing masks, as has been mentioned. So the fundamentals again: to stay home if you're feeling ill, even if you are only mildly feeling unwell, please stay home. To practice good hand hygiene, to not share items with others, and to practice physical distancing when you're out with others outside of your household. And again, the current public health recommendations around mandated masks and the group size restriction to 10 within indoor and outdoor public places. I also want again to speak about stigma and to remind ourselves to be kind and realize that we're all in this together, because we do know stigma has no place in response to a pandemic. It very much so adversely affects our public health ability to manage this. It decreases our likelihood for those who need to be tested. It also decreases the likelihood for those that we need to connect with in public health, to connect with contacts, that they will continue to follow up with public health. And again, there is no place for judgment or shame to those who have contracted or who have recovered from COVID. And as well, we do not want stigma towards those to where they live or work. We need to be kind to one another, because we need to work through this together. Around testing, we do want to encourage symptomatic testing. We do not want to encourage asymptomatic testing. We are asking employees to only send their their employees for testing if they are symptomatic, and to not be encouraging asymptomatic testing. If there is any asymptomatic testing required, that will be recommended by public health, and they will specifically contact those that would be recommended to be tested in that regard. And lastly, if you experience symptoms, if you can ensure to self-isolate as soon as you develop symptoms, even if they are mild symptoms. This means staying at home, avoiding others in your household. You don't go to work. You are not to go to gatherings with friends. You are not to go to religious gatherings. You are not to go out for any brief errands. It does mean to stay at home. And this is challenging. We understand that. But we really appreciate everyone's attention to that and ensuring to do that. Then to have testing done if you are symptomatic, and ideally to have that testing done 24 hours after your symptoms develop, because that is when the test is most effective. And then you will hear from public health if your test is positive. They will contact you with further directions, and they will discuss again the plans around self-isolation. If there are any challenges related to the ability to self-isolate, if you are a positive case, there are isolation centers available, and public health will be able to assist in that regard. And again, we want to encourage those who are positive with COVID to share their information regarding contacts so that we can ensure to appropriately be in contact with those who would be close contacts of anyone that is positive with COVID, to try to ensure to help everyone in our province, and specifically in Prairie Mountain. That is all the information I have at this point to share, and I'll pass this over back to Mayor Krest. Thank you kindly.
Well, thank you very much, Dr. Fukuda. Once again, a tremendous amount of information, just really timely. People really need to stay focused on all of this information and all the various measures that are being provided, recommended, and ordered by public health. And we do highly appreciate Dr. Fukuda being able to come on with us periodically. As she indicated, she's going to be back with us again on Thursday, along with the superintendent of the Brandon School Division, Dr. Mark Cassavan, to talk in more detail about school opening. So we'll look forward to that on Thursday. So now, in the meantime, I'm going to pass it back to our emergency manager, Mr. Brian Kays, for more local information from his desk.
Well, thank you, Your Worship. The theme of responsibility continues. For the adults in the audience, stand up and take responsibility for yourself and your families. Your actions as an adult impact your children, vulnerable people, and the elderly. Perhaps you too hope to live long enough to one day become elderly. Whatever comes around goes around. It's time to seriously start taking responsibility for this community that you are a part of. Hear this, Westman, Prairie Mountain Health Region, Brandon, Manitoba, wherever you are out there. Things are getting worse here. We are setting records for the number of ill people in our area, and we're not particularly proud of it, and rightly so. The province is stepping on us for it. Code Orange, restricted. Anytime you are out in the public, you must keep your group size to 10 or less. And it doesn't matter if you are in a building or outdoors, the maximum number in each gathering on public property of any description can be no more than 10 people. But there is an important exception here. This does not include activities that already have measures in place, such as day camps or public swimming pools, organized sports, and religious events. These activities have measures in place to control exposure to COVID-19. So, an impromptu soccer match played in a public park can have no more than 10 participants. But a soccer match organized as part of a league can fill the roster on both teams. The spectators must be in groups of 10 or less, and every spectator must practice physical distancing and wear a mask. The second measure for us is that the wearing of masks has been made mandatory for everyone in public buildings and for everyone at public events or gatherings. We are seeing it already. Brandon has masked up. Don't even think about coming into a City of Brandon building without a mask over your mouth and nose. Indoors, in City Hall, wear a mask. On a bus, wear a mask. In the Sportsplex, wear a mask. Outdoors at the Sportsplex, wear a mask. In our parks, in a group of 4 or more people, wear a mask. Watching your children play in the park, wear a mask. For the next little while, this is the new normal. If we don't get control of things, there will be nothing new about it. It will be just the way it is. How do we prevent this from happening? Behave yourself. Keep your distance from people. Don't breathe on them. Don't hang on them. Don't touch them. Leave them alone. Take some responsibilities for the situations that you thrust yourself into. Frequently wash your hands by rubbing and scrubbing for at least 20 seconds and dry them on a clean towel. Keep your hands clean. Keep your hands to yourself. People touch their face 250 times a day. That's 250 opportunities for COVID-19 to find you. Keep your hands clean. Keep your hands to yourself. Cover your cough or sneeze. Nothing is grosser than having somebody sneeze on you. Be polite. In addition to being safe, sneeze into a tissue or the crook of your arm. If you are sick, where are you going to go? No place. You're going to stay home. Stay home if you are sick. And if you have any of the COVID-19 symptoms, use the online screening tool at manitoba.ca/COVID-19 to see if you should get tested. When you are sick, stay away from everyone. Practice physical distancing. And if you practice, you'll get good at it. Stay 2 meters away from everyone else. 2 meters, 6 feet. Stay away. Make sure the size of any group you join has no more than 10 people, including yourself. Before you join, wash your hands and put on a mask. That's the new rule. Also, continue to stay 2 meters away from people except for very short interactions. Masks do not replace physical distancing requirements. Masks improve our level of safety when we all take responsibility and work together. Wash and disinfect commonly touched surfaces. You know what they are. Keep them virus-free. If you've got stuff you like, don't share it. It's too risky to hold someone's phone when you have no idea where it was, who else has held it, or when it was last sanitized. It's okay to look at the photos or the text, just don't touch it. Wear a mask or face covering unless you are not medically able to do so. And finally, in everything we do and say, please be kind. You know, the coolest guy you could ever hope to meet is Ringo Starr. And he still says, all you need is love. And he's been saying it since 1967. All you need is love. Let's be kind to one another. Let's kill COVID-19 with kindness. If you're returning from travel outside of Canada, you must quarantine for 14 days. This is a requirement of the federal government. If you're coming to Manitoba from points in Canada east of Terrace Bay, use the provincial self-isolation guidelines, which also require 14 days of isolation. Use reliable information such as manitoba.ca/COVID-19. Finally, do not call 911 unless it is an emergency. Please, work with us, do your part, and we will do ours. Thank you, Your Worship.
Thank you very much, Brian. Certainly lots to digest lately. You'll notice that Brian and I, even though we're certainly well physically distanced in a very large room, we were wearing our masks today. Dr. Fukuda, on the other hand, as you could tell, she was calling in remotely through the marvels of technology, and she was on her own in her private office, and therefore not needing to wear a mask as she was by herself. So Prairie Mountain Health and Brandon in particular at an especially critical time, a situation that requires the utmost in individual participation, every one of us. And we all know all of these fundamentals, which now includes the wearing of masks, is not especially pleasant or convenient. But folks, under the circumstances, and if you really consider the big picture, these personal measures, hand sanitizing, physical distancing, and wearing of masks in public places is a relatively modest action we must take to keep ourselves, our family, friends, and our community safe and healthy. The other personal responsibility I wish to emphasize is our actions if we suspect we might have COVID or if we test positive. You'll be given instructions by public health, but again, it is imperative that you immediately self-isolate, which may also include members of your household and other close contacts. Failing to do this perfectly is what has led to this very large cluster. So we must implore everyone to follow the guidelines, both in terms of the personal protection measures and the self-isolation measures that are prescribed in the event that we are infected. Brandon and Prairie Mountain Health, we all need to once again be COVID-19 warriors. This virus shows no mercy. We all know what to do. Let's bear down, follow the fundamentals, wear the masks, perfectly self-isolate if we are infected or exposed, and let's flatten the curve once again. So as you know, we will be back on Thursday, August 27th with Dr. Fukuda and Dr. Cassavant from the Brandon School Division for more updates. In the meantime, be safe, be very vigilant, and most of all, be kind. Thank you for staying abreast of credible local information, and we'll see you next time.